We get a lot of questions about male fertility, especially about something called varicoceles. Varicoceles are incredibly common. They're occurring about 15 to even up to 40% of people with infertility. Their baseline rate in the general population is about 10 to 15%. Varicoceles are essentially sort of varicose veins in the scrotum around the testicle. Any organ has blood supply, and there is blood going to the organ, which is an artery, and blood going away from the organ, which it then returns back to the heart, and these are veins. So varicoceles are essentially the veins that leave the testicle, bringing deoxygenated blood away from the testicle that becomes distorted, distended. How veins work is veins don't really have an active pumping mechanism. So arteries are connected directly to the heart wall, and the heart pumps an artery, so blood flow is actively transported into that end organ. However, when the blood returns, is actually more passive in nature, so there's no actual pumping that blood back out of the organ back to the heart. It involves essentially passive flow of the blood. And in these veins, there are essentially little valves that ensure that the blood flows one way, that is away from the organ towards the heart. When these valves don't work, then there is backwards flow of blood back into the organ, and that's what essentially are varicose veins. These are veins that have defective valves and that flow back into their organs, and these veins get distended. So the same thing happens in the testicle, and when this happens, these are called varicoceles, and essentially it comes from the Latin word varix, meaning distended veins, cele meaning a tumor, so essentially a clump of distended veins. Some people describe it as feeling like a clump of worms around their scrotum. It's quite gross when they're described that way, but it's a very common description. Mainly these are asymptomatic, and sometimes we only find them on ultrasound or when we actually feel closely during an examination. Sometimes there is a bit of a dragging sensation. Sometimes it's worse when people cough or sneeze. So the presentation is various. I suppose from a fertility side of things, we're really concerned about varicose veins when they have an active sort of impact on the quality of the sperm. So they can impact quantity, the way that the sperm moves, they can impact the normal shape and form of the sperm, and they can impact the DNA integrity in sperm. The mechanisms are a little bit controversial, but we think it's generally via a couple of mechanisms. One is that if there is ongoing blood backflowing into the testicle, that blood is actually sort of body temperature, it's warm. Testicles really need to be about 1 degree lower than the rest of the body. So when you actually have increased amount of blood that doesn't flow away but stays in the testicle, so that blood warms the scrotum. And that 1 degree Celsius increase doesn't sound like much, but it is enough to actually have a significant impact on sperm function, and actually that fact is sort of played out sort of every day. We see, especially in people who have occupations that expose their scrotum to high heat. So one mechanism of varicose veins is that because of the increased blood around the testicle, it's warmer. Second thing is that paradoxically, the increased blood around the testicles is actually not oxygenated blood. So this is blood that has used up all its oxygen, it's delivered its oxygen, and really it should be flowing back to the heart to be reoxygenated and pumped back into the testicle. But it's not doing that, so it's staying put and pooling in the testicle. Now that means that the testicle has a relative lack of oxygen, and it's theorized that relative lack of oxygen is affecting sperm production. It also these bloods are also when blood stays there, they kind of form things called reactive oxygen species or free radicals. So these are chemicals that are formed from static blood and formed from accumulation of toxins and waste products, which is one of the functions of blood going away from organs, kind of taking all that waste product away. And when that accumulates in the testicle, then these reactive oxygen species, these free radicals, accumulate and they damage the cells and they damage DNA. So these, we think, are the main mechanisms how varicoceles form, contribute to infertility. So do we need to do anything about varicoceles? So that is actually where the controversy lies. With the advent of IVF technology, a lot of what the bad stuff that varicoceles can do to male fertility probably can be overcome with IVF technology. However, in cases where IVF technology is not enough to overcome these factors, where conservative lifestyle management, things like antioxidants, frequent ejaculation, healthy life and diet isn't enough to increase the sperm quality, or if the couple simply do not want to do IVF, then surgical management of varicoceles is recommended. Surgical management of varicoceles can only be done in the hands of an experienced surgeon. It is done either by tying off the vein at its origin, high up in the groin. These veins can also be blocked via an X-ray guided procedure, or these veins can be separated, blocked and tied off microsurgically. So that is using an operating microscope and actually separating these veins out one by one, which is very time consuming but highly effective. So there is no universal management for varicose veins, but it is a big cause of infertility. And it is something that should be noted and taken into account when sort of looking at the couple as a whole as to what their reasons for being unable to fall pregnant are.